So what is bed bath? Bed bath is performed in a bed, given to a client who is not able to bath himself. Now the purpose of bed bath is number one, of course, is to clean the client's body from germs or any other bacteria that may foster in the skin. Second, is to stimulate circulation and improve general muscular tone and joint. Third, of course, is to give them comfort and help them go to sleep. And lastly, is to observe skin condition or any other objective symptoms. So, in performing bed bath we are guided by the following guidelines. First is to confirm doctor's order, because sometimes the bath order may have changed. Also, we need to check the client's identification and condition. This is because in some instances, giving a bed bath may be harmful to a client who is in pain, hemorrhaging, or weak. The next thing that we have to do is to greet our client and also establish rapport. We need to ask them about their personal hygiene preferences and their ability to assist with the procedure.
So today, I will be performing bed bath. For the initial procedure, I have to greet first the client and also validate some information about him or her. So in validating information, we have to observe the band of our client and also ask the client to state his or her name and also his or her birthday. Good day, sir. I am Nurse Shira. May you please state your name and your birthday, please?
My name is John Chris Adalid, and my birthday is on February 6, 2000.
So hi, Sir JP. How are you?
I am fine.
Okay, that's good to know. So today, I will be performing the bed bath, so I will be cleaning your body while you are in bed. So why do you think that we have to perform this procedure?
I need to freshen up.
Yes, very good. Because I will be cleaning your body from the germs and other vectors that can foster in your skin. The reason why we do bed bath is to improve your circulation so that your blood will flow perfectly in your body. Also, we perform bed bath to provide you comfort and help you go to sleep. So can you help me in performing this procedure?
Okay, nurse.
So after establishing rapport, we need to prepare all the equipments that we need for the bed bath. So I have all my equipments here already. We need to remember that prior to performing bed bath, we need to perform proper hand hygiene. And of course, also don our gloves, but this is optional. Donning of gloves is optional, but it is a must when doing a perineal care or genital care. Donning our gloves, we are also reminded a few more things. So if there are any curtains or any doors here, we need to close them in order to provide warmth and privacy to our patients. With that, you may now proceed to the next step, which is to get our basin that is full of water, and we need to let our client to check the temperature of the water if it is tolerable for them.
Okay, this is good.
So after we have covered our client with a blanket, we may now proceed to remove the pillow and also put the big towel under his head and a towel over his chest. After that, we may now proceed in wetting the towel.
After the initial procedure, we may now proceed in cleaning the eyes of our patient, making sure that we do not do it with soap as it may irritate the eyes. Therefore, we want to clean the eyes of our patient from the inner surface to outer surface using different side of the cloth. This is to avoid sweeping debris to the eyes of our client and also to avoid the spread of infection. Now, let us proceed.
So now I'm going to wash the eyes of my client from inner surface to outer surface using different sections of the cloth.
Now, we can proceed to cleaning the face of our patient. So in cleaning the face, we can use soap only if they preferred it. Remember that soap is drying to the face. We may also follow the number 3 pattern. So from the forehead, going into the nose, and from the nose go to into the chin. We may also want the ears of our patient as well as their neck.
So now, we can proceed to washing the face of our client from the forehead down to his neck.
So after cleaning the face of our patient, we may now proceed to the upper limb. So including the upper limb, we can now do long strokes. It stimulates circulation by facilitating venous return. We also want to start from the distal to the proximal, so from your head up to your axilla. Now I want to remind all of you that while I was performing the bed bath on the client, the bed was already close to the cabinet, hence I cannot go to the other side of the bed to do the other arm. But you need to be reminded that the same procedure will be performed to the other arm of the client. The same thing that you did to the first arm.
So now, we are going to proceed in washing the upper extremities of our client. We are going to wash the arms from the distal to proximal, so from the hands to the axilla. So now, we may proceed to washing the axilla of our client. So you would want to repeat the same procedure for the other arm, but since the bed is already at the side and I cannot go around it, I will just tell you that we still need to perform the same procedure on the other one.
Now that we are done with the upper limb, we can now proceed to cleaning the chest and the abdomen of our client. So one thing to remember here is to put the back towel under the back of our client so that we may avoid wetting the bed, and also put the other towel over his or her chest, so that we may be able to provide privacy that our client needs. After performing this procedure, we can change the water that we are using. Number one reason is that it might have cooled down already, and the second one is it might have been unclean. So before proceeding to the next step, which is cleaning the lower limb, we can first change the water that we are using. Now that we are done, and we already changed the water that we are using, we can now proceed to the lower limb. So we have to bend knees of our client, and this will allow us to have easier access to the top leg and also to the bottom part of the leg. It is necessary to provide pillow or cushion underneath the knee so that we may be able to provide support. In cleaning the legs of our patient, you also want to start from distal to proximal. So from the foot of our patient to the knee, and from the knee to the upper leg of our patient. So again, I would like to remind everyone that when I was performing this method, the bed was already close to the wall, hence I cannot go around the bed in order to clean the other leg of my client. But what you need to do here is what you did with the first leg. You just have to clean the other leg. Okay. We may now proceed to cleaning their back and their buttocks. The next thing that we have to do is to observe for any skin indications, as skin breakdowns commonly occurs over bony areas, so we have to also be careful in cleaning the sacral area of our client. So the first thing that we have to do here is to turn them on a lateral position. This allows us to have easier access and visualization of their back. So if the client isn't able to assist us in doing this procedure, the first thing that we have to do is to bend their knees and turn them into a lateral position, making sure that we are gentle in every move that we make. And also, if ever needed by the client, we may also perform back rubbing. So after performing all the steps in bed bathing, we have to make sure that the client is comfortable before taking them to sleep. After this, we need to do our documentation.